many people are in the queue or are listening in there.
Hello, everybody. I'm Teresa Snow, and I'm Executive Director of Strategic Communications for MU Healthcare and the School of Medicine. And welcome to our town hall. This is intended for employees of MU Healthcare and the MU School of Medicine. So if you don't work with us, we kindly ask you to drop off the Zoom. Like we always do in our town halls, we're going to have some updates from our senior leaders and then answer some questions. We received about 13 pre-submitted questions. If you have a question during today's town hall, you need to enter it on the link that you found on the intranet page where you were on for the Zoom link. We're not taking questions on the side of YouTube this time. You need to enter them from the link found there on the intranet page, mymuhealth.org. You can also ask questions anonymously. If you are joining us, we're so glad you could. If you don't get to hear the whole session or you have coworkers who weren't able to join us, be sure you mention at your huddles and to your coworkers that the full recording of this town hall will be available on the internet after it's completed. And it will also be pushed out through our official e-newsletter, which is MU Health Today, comes out on Tuesdays and Thursdays. So with no further ado, on with our town hall, and I turn it over to our boss, our Executive Vice Chancellor, Rick Barron. Rick?
Thank you so much, Teresa. Well, welcome to our town hall. I'm Rick Barron, the Executive Vice Chancellor for Health Affairs, and I'm very glad you can join us today. I'd like to begin by thanking every staff, provider, and administrator who worked so hard to make our big November 16th moving day a success. Nearly 24 departments collaborated to move our children's hospital services to a temporary home inside the University Hospital. I was able to round in our newly relocated pediatric units with Christina Volrath, the Executive Director for Women's Health and Children's Hospital. And here are some pictures from that recent rounding event. I was able to speak to a young girl with cystic fibrosis on our pediatric unit, and I asked her and her mother how move day went, and they said it was perfect. And it was so great to hear that positive feedback. I also met with Corrine Joplin with our child life team and our facility dog Link, who graciously let us pose with him for a photo as my first Link picture. We stopped by our pediatric gym, the pediatric ICU, and the Children's Cancer and Blood Disorders unit, and our procedure suite, and the post-anesthesia care unit. Here I am in the gym with the therapists that work in our temporary new pediatric PTOT gym. So months of planning went into making this day a success. And I'm so proud of our teams who helped to achieve this major milestone in bringing our inpatient services to one centralized campus. I've had lots of positive feedback about not only how the move went, but about how great it is to have things all, many of these services now all on one campus. So now I would like to introduce Shannon Fusick, our new Chief Nursing Officer. Shannon joined us last month from Children's Mercy Hospital in Kansas City. And so she has hit the ground running and has been very busy in her leadership for our outstanding nursing practice. So Shannon, welcome.
Thank you so much, and good afternoon. I hope everyone has been able to spend time with family and friends over Thanksgiving, as well as the rest of the coming holiday season. It's so important to take time to do that. This is my first town hall at MU Healthcare as your CNO, and I could not be more pleased to have had the opportunity to join the organization. I hope you were able to watch my introductory video on the internet where I shared a little bit about me personally and professionally. During that video, I talked about a listening tour to personally get to know the culture at MU Healthcare, as well as learn what's on the minds of our nurses and healthcare team members throughout the organization. I am happy to report that I've had 28 one-on-one meet and greet meetings. I've attended 30 tier 1, 2, or 3 huddles. I've experienced a 2.5-day nursing orientation at the Learning Center and went on 7 leadership rounds on days, nights, and weekend shifts to engage with our frontline team members. All of that being said, I'd like to share some reflections of my experiences from the lens of a new employee. I have been struck by how warm and welcoming everyone has been to me as I've transitioned into my new role. This level of kindness has allowed me to feel more a part and connected to the culture at MU Healthcare much sooner than I would have anticipated. It is evident in the huddles and in my one-on-ones that everyone from the executive team to the front line come to work to serve the needs of our patients and their families the best that they can. The executive team is engaged and focused on removing barriers that exist, providing the best care for our patients and their families. The team works well together and defers to each other's area of expertise to serve the mission. I am assured by the passion and pride that is exuded by team members as I round in their areas and share with me their amazing work, as well as the opportunities for support. Because of the pandemic, we are seeing workforce challenges around the world, and healthcare industry is at the top of the list. The challenges are no different here at MU Health. During rounds, while talking to staff, workforce shortages is the #1 topic. I am humbled by the level of teamwork and collaboration that occurs each and every day to continue to serve the needs of our patients despite the shortages. Workforce challenges are top of mind at all levels in the organization, and there is much work to understand, adapt, and continue to serve the mission in these challenging times. I have been a part of magnet submission preparation meetings where stories are considered for submission and have been blown away by the extraordinary and innovative multidisciplinary research and performance improvement work that is ongoing despite the many challenges of the last 2 years. All of this gives me hope. Hope that when the external forces of the pandemic lessen, that we will be stronger and so much further down the road to achieving excellence. I will continue more of the same in the next 4 weeks with the addition of focus groups of nurse leaders to understand their challenges and remove barriers so that they can be successful and fulfilled in their roles. Thank you for this opportunity to connect, and to everyone that comes to work and says yes each day. Thanks so much.
Thank you, Shannon. And now it's my pleasure to introduce our CEO and welcome Shannon Fusick to the organization. It's my pleasure to introduce our CEO, Jonathan Curtright. Jonathan.
Thanks, Teresa. And Shannon, Dr. Fusick, welcome. You're a great addition to our team. You have a wonderful spirit and a leadership style, and you'll do some great work for us. And so many people have already had so many positive things to say about Shannon and her work. Welcome to the team, Shannon. It's going to be great. All right, a couple of things. We are in a celebratory mood right now for a little bit. Kudos points. I love getting the kudos points. I don't know about you all, but it's always so fun when they show up. And you can go on a little bit of a spending spree, if you will. So every employee will get 150 kudos points, which is equivalent of $750. And that will be ready to go the week of December the 20th. Thanks to Team HR for making this happen. Now we're going to do something a little bit unique this year. We're going to have, I believe, 16 or 14 different days and 6 shows available at either the Forum 8 or at Ragtag for a holiday movie celebration. You can bring a guest. There will be discounted concessions. It's going to start here this week on Wednesday, the 8th. And you can go to mymuhealth.org for additional details on this. But I think it's going to be a blast. And it'll be a way to say thank you and celebrate a little bit. And thank you once again to the creativity of Team HR for allowing us to come up with another way to say thank you to our outstanding team here at MU Healthcare. So make yourself available for a holiday movie celebration, and you can find out more at the imuhealth.org. All right, fiscal year 22, or that is next year, if you will. What are we going to be working on? If you think about it, more and more, COVID has dominated, and I'm not going to say we've had a mono focus, but we've had a lot of focus on alignment to deal with this public health crisis. I'm so proud of the team and the work that's happened with Incident Command. And furthermore, I'm confident that our new system, our new care, our new models, our new leadership, if you will be able to deal with any variant that comes down the pike. Thanks to Dr. Beck and Dr. Settles and Dr. Witt for their leadership on our Incident Command. But now, as we're transitioning in this pandemic, we are going to be moving the COVID response into much more of our normal day-to-day operations. So it is no different than any other challenging pandemic that's happened. But I do believe that over time that we have proven that we can manage this, and we can manage it with our normal day-to-day operations. As far as other things that are out there that are going on in a significant way, Dr. Barron described our phase 1 integration, moving all of our PEDS practice to the to the University Hospital campus has happened. That has only been able to happen through probably thousands of people working on this and working on coming up with new facilities. How can we better optimize our existing space? How can we change our operations to make it so that this children's hospital could be integrated and combined even more quickly than the summer of 2024? So special thanks to everybody in facilities and in operations for making this happen. It has been an outstanding moment. There's some other things that have been going on of late. October was an incredible month. We had the groundbreaking for the new children's hospital. We had the grand opening for NextGen, and more of imaging has been happening and will continue to happen in our NextGen facility. And our future focus is going to be so focused on specialty services. You're going to be hearing about this over and over again. We have done very, very well over time as an academic health system. However, we need to make significant investments in oncology, in cardiovascular, in our neurosciences to ensure that we have the best of the best in these service lines. We'll be working very, very closely with the School of Medicine to ensure that we have the right physician leadership and the right amount of cardiologists, hematology, oncology doctors, and neurologists and neurosurgeons to take care of our patients that suffer from these very challenging diseases that are a key part of these service lines. So we're actively working on this. This is going to be where our growth is going to be moving in the future. And that is going to continue to be, we're going to be making major investments in ambulatory services and our staffing and in our new faculty and C subspecialties. But the thing that I really wanted us to focus on, and it's something that's a part of what we do in our culture of yes, is this concept of together we can do nearly anything. Together we are aligned. Together we can take care of the most challenging pandemic. Together we can move and consolidate hospitals in a short few months. But we must do this as an aligned team. And it is our strength. It is what we do each and every day with the School of Medicine and MU Healthcare. And our number one thing that we can do coming out of the COVID-19 response is really doubling down and focusing on integrating our teams and having a together we culture. It is a critical part of what we do each and every day. And it is something that's going to drive us into the future. So with that, once again, thank you to Dr. Fusick for joining us. And with that, I think I'm going to hand the ball off to Dr. Zweig. Dr. Zweig, or Teresa.
Thanks, Jonathan. I'm Steve Zweig, I'm Dean of the School of Medicine. Let me first say thanks to each of you for your continuing commitment to excellence and service as we deal with the challenges of this pandemic and the hard and important work that you do every day. To paraphrase Nelson Mandela, after we've climbed great hills, we find that there are many more hills to climb. Our people are working hard. For example, our UP colleagues reported that last month was the best ever for professional clinical revenue generated by our clinicians. We also know that the hospital and clinic staff are overloaded. Despite everyone's best efforts, we still have problems with clinic staffing and referrals management. Please know that we've already made some progress on these, and there's a lot of good work left to do. We've just made a major transition of mostly inpatient services for children to the Hospital Drive campus. Its success was due to the work and planning of dozens of health system leaders, physicians, nurses, and other staff. The teams that Jonathan refers to really showed up, and that work's ongoing, and there'll be more hills to climb. We implemented a vaccine mandate for our health system and our professional schools with over 99% compliance. We will make safer our colleagues, students, patients, and community. We've also successfully completed all of the requirements of the 5-year corporate integrity agreement of the Office of the Inspector General. It's been hard, but we now have better established policies and procedures which reinforce behaviors focused on patient safety, employee engagement, professionalism, and financial integrity. That was another hill we climbed, and thanks for your work on this. Our scholars have generated over 200 COVID-related articles, contributed to understanding the sources, consequences, prevention, and treatment approaches to this pandemic. Clinicians are also involved in over a dozen COVID-related clinical trials. And due to the great success of our faculty, research expenditures continue to rise, and we'll reach new records there as well. Should also know that a group of faculty and other leaders have been working on a replacement to the university's discontinued research incentive fund. And you'll be hearing more about an upcoming plan to distribute the indirects that come back from grants and a new awards program for PIs leading the most competitive federal grants. We also just received a commitment from the campus to supply up to $20 million for lab renovation in our 1956-era medical sciences building. That's really good news. Our 4th-year medical students are preparing for the residency match, which will again be virtual this year. And our tireless medical school admissions committee is working to fill the next class with an equally outstanding group of entering medical students. Strong leaders are important to our success. Next month, we will start the Physician Leader Development Academy, a new leadership program for 22 of our developing physician leaders. These folks are so important to our current and future success. We're currently evaluating chair candidates for both neurology and physical medicine and rehabilitation, as well as a cancer center leader. During my time as dean, I've had the opportunity to appoint 10 department chairs, who with our other chairs are committed to you and our enterprise. Our new chair of OBGYN and Women's Health, Dr. Jean Goodman, will come from Loyola Medicine in Chicago and be joining us this month. Dr. Mitch Goldman, who will lead our graduate medical education programs, arrives next month. He's an infectious disease specialist and GME leader at the University of Indiana. Thanks also to Dr. Mary Dorman, who has stepped into that role in the interim and who will continue to serve as Associate GME Director, working with Dr. Goldman. Our residency and fellowship programs are so vital to our teaching and clinical missions. We know that our students, residents, fellows, faculty, and staff keep climbing those hills. Don't forget to take stock, recognize what you and we have accomplished. Also, please keep showing the respect that you have for our patients, our learners, and each other. To again quote Nelson Mandela, we've taken a moment here to rest, to steal a view of the glorious vista that surrounds us, to look back on the distance we've come. But we can only rest for a moment, for with freedom comes responsibilities, and we dare not linger, for our long walk is not ended. I really appreciate being able to lead such a committed and talented group of people. I know you're tired, and while we must all learn to rest, we cannot give up. So thank you for all you do to further our mission. Together, we can save and improve lives with our exemplary education, research, and patient care. I want to say happy holidays to all. Dr. Stephen Witt, our Chief Clinical Officer and Senior Associate Dean for Clinical Affairs, up next. Steve?
Morning, everybody, or I guess it's afternoon now. It's very good to see everyone. I didn't have a chance to tell everybody happy Thanksgiving, so I'm going to take it late. Happy belated happy Thanksgiving. I hope things went great. Mine was wonderful. A nice time to recharge and just remember the good things, what it is we get to do for others, what others have done for us. Also, if you are struggling, please reach out. Now's a good time to reach out to your colleagues and friends. There's a whole lot of people out there who love what you do. I get to talk about COVID, which is not my favorite thing to talk about, but we do need to give you an update. About 3 weeks ago, we rose up into the 40s for the first time, and it was concerning. Today, we're in the 60s. And this is the same that we're seeing across the region, across the Midwest, and of course, across our country. The number of ICU patients has also more than tripled in the last several weeks. So COVID is here to stay. Some of the things I did want to talk about, which I think are questions, at least are questions I'm hearing in the hallways, are what about Omicron? It's just a handy Delta, Omicron. I noticed I didn't say Epsilon, so Delta, Omicron, both cool names. I did notice that the ones that are most likely to stick get the coolest names. I don't think it's the other way around. A few things we don't know yet. Will the vaccine cover Omicron? So far, the monoclonal antibodies that we have been giving to people seem to bind with Omicron. Also, serum drawn from patients who've had COVID also seem to bind with Omicron. That is a preliminary positive sign that likely the vaccine will cover. But until we see it hit a large population, we just don't know yet. Will Omicron sweep across the US? Also don't know. The reason it's in the news is because it has lots of variety at some of the nuclear sites that predict that it might be more contagious. So there's lots of speculation that it may be the next large sweep across the US. And then, is it more deadly? Is it less deadly? Honestly, each and every variant, I have had someone tell me, I have heard someone say, I've seen it on the news, that the good news is it looks like this one is less deadly than, or less virulent, less deadly, less poison than the other ones. And that has never turned out to be true yet. We hope it's true with this one, but we just don't know yet. Also, some new information I've been promising. I've been talking about how after you get COVID or after you have been vaccinated, that you have, of course, the antibodies that last in your bloodstream for quite some time. But in everybody, those fade over time, even while you remain immune. And so there's been a question of whether or not the booster simply makes your antibody response go up, or if it also makes you more immune. And over the last 3 weeks now, we have several papers, several scientific studies that have shown that actually you're even less likely, although we've talked before, it's somewhere between 8 and 20 times, depending on whether it's just get COVID at all. You're 20 times less likely to get it, or to get seriously ill, you're 8 times less likely to get seriously ill with a vaccine. If you're boosted, it actually gets even better. There's a clear separation in populations that have been vaccinated and still get a case of COVID versus booster populations, which have been less likely. So there does appear to be a benefit to getting boosted. Your reaction, if you got a reaction the first or second or both, you're going to have a reaction again. That's the only thing I can tell you to the vaccine. Almost none of the vaccine reactions I have heard about, read about, or can imagine have yet equaled COVID. So I encourage you. I am scheduled to get mine Tuesday, my booster, just to let you know. And my family's going to get theirs at Hy-Vee sometime this week. Probably all I have to talk about. I think you get the main idea. I did get to be on service a few weeks back. It was a pleasure to work with all of you. It's amazing the work we do. Every time I get to thinking that, man, I wish we could do this better or that better. When I get to the real patient care bedside, I am amazed at what great work we do. Of course, we can get better, but we're still pretty awesome. Few other things. If you are struggling, I already mentioned it. Reach out. If you're not, some of the things that I have noticed when I have struggled this last couple of years is the simplest little email or simplest little mention in the hallway of, hey, I just want to let you know I appreciate you. Holy cow. That little phrase gets me going for about another week. So it's like jet fuel. Just a little bit of thanks, a little bit of appreciation to your colleagues will go a long way. So please take 30 seconds and do that sometime this week. See ya.
I'll just echo that. I was rounding with environmental services last week, and they said it just means so much when someone outside their team says thank you for what you do. And, everybody has a piece in the team and helping our patients get better. I'm pleased to announce our Chief Hospital Operations Officer, Carrie Simon, is next. Carrie.
Great. Thanks, Teresa. Good afternoon, everybody. I just want to take a few minutes to add on to what others have already talked about regarding the successful move of our pediatric services several weeks ago, and to say a huge thank you to everybody that was a part of making that happen and making that successful. So on the 16th of November, we moved all of our inpatient and some of our outpatient pediatric services, as you all are well aware. And we got very fortunate with beautiful weather that day and a census that dipped down a little bit. So that after quite a few discharges from Women's and Children's Hospital, we actually moved 14 inpatients over to our new pediatric and pediatric ICU temporary homes at University Hospital. Very predictably, there are certainly things that we continue to identify and work through to make better. But the great news is that most of those have been either small in nature or very easy to resolve. The one exception to that that I want you to know that we hear and that we are working on is around our emergency services. So the great news is that once pediatric patients get into our children's ER, the care that they're getting and the feedback that we're hearing is all fabulous. But we do have adults and kids entering through the same entry point, waiting room point, registration and triage, and certainly that can leave something to be desired. So please know that we are aware of that issue and are working to make that better. And so stay tuned as we identify options for that. But overall, fantastic success, and so excited, as others have already said during this hour, so excited to have more of our family on one campus, and looking forward to 2024 when we're able to bring the remainder of our Women's and Children's family over to this location. So just wanted to share that update. And again, thank you to everybody that was a part of that. With that, I will turn it over to Nikki Magruder.
Hello, everyone. I hope you are all enjoying the holiday season, even during the hustle and bustle that comes with it. I want to take a brief moment to celebrate all of you. I want to say Happy Hanukkah on this last day of the celebration. I want to wish you all a Merry Christmas and say Habari Gani in preparation for a blessed Kwanzaa celebration. I'm sure there are other holidays that I haven't mentioned within our wonderfully diverse MU Healthcare family. So if you celebrate other winter holidays, please reach out to me. We would love to learn about them and celebrate with you. We are developing an educational winter holiday banner series for 2022 and would love to include as many winter holidays as possible. If there are any other ways that I can support you, please reach out. So again, happy holidays, everyone.
Thank you so much, Nikki. I wish we could just wrap up the town hall with your smiling face saying happy holidays. But alas, I will shift to the questions that we got from our employees because it's really important for them to know that we've heard you and heard the questions. If you have questions that come up, we've got about 30 minutes, so we're running a little bit ahead of time here. You're welcome to put them in the link where you found the Zoom link to this town hall on the intranet page. You can enter a question there as well, and they will share it on the chat with me. So I'm going to go back, and I know I asked you the same question a couple times, Dr. Witt, but people might be just joining us, and we might just answer it again. But you said you're getting the booster shot and your family's getting the booster shot. Somebody says, should I get it? I'm not in any of the at-risk categories. Should I wait a little longer? Or do it now because they're worried about holiday events, more indoor time as winter approaches. Wait, what about the at-risk categories?
Yeah, if you'll notice, even the CDC was not taking a stance on whether or not the boosters should be given or should be received. They only talked about the at-risk people. If you go to the CDC's website today, like I have, you will see that now it's completely recommended. The reason for that is because there have been several studies now that show that not just does your antibody level go up, but that your rate of infection drops. And that's not rate of infection only against unvaccinated individuals or those who haven't had COVID before. That's even compared to people who've had COVID and compared to people who've been vaccinated. So the booster gives an added benefit, no doubt. That's why I'm going to get mine.
And someone's asking, I received the booster at an outside pharmacy. Now, of course, Staff Health gives it on Tuesdays and Thursdays. Is there an email that I need to send a copy to update my records? Beth or Steve, do you want to take that one?
I think I can take that one. Beth will back me up. Boosters are not required, but if you would like us to have a record of it, just send the copy by email and we will put it into your Staff Health record. Right, Beth?
Right. You can also upload it through ReadySet like we did with the vaccination mandate. And the email for Staff Health is umhshr@health.missouri.edu. So again, that's umhshr staffhealth@health.missouri.edu.
Great. I have my appointment in 2 weeks, and Jonathan Curtright just messaged me that he has his booster already. So thank you, Jonathan. Triple vaccinated. I have someone asking, I have a grandson. They heard on the news that the COVID vaccine was going to be like a third of the adult dose for 11 and under. Wasn't sure about the guidance for children and the flu shot. Can you clarify for me? Says, not sure if it's the same dose as what adults will get. It would be the first and second dose for the grandson at 11 years.
There is a different dose for kids 5 to 11. People do not need to know that. The healthcare providers, all vaccine sites know which dose to give who. There's only 2 different doses, one for kids 11 to 15. So far, depends on how many vaccines come out. But there's only one for kids 5 to 11, and then there's a different dose for people 12 and up. But you really don't need to know that. The vaccine sites definitely know that.
There was an ethical argument that the U.S. giving booster shots displaces vaccines from countries that haven't had the opportunity to vaccinate large parts of their population. What can you say about that? Is there enough to do booster shots here and first doses other places?
There is a vaccine excess almost everywhere. I am not expert enough to tell you that every single country has excess vaccine. But there is more than enough vaccine to go around to vaccinate everybody who wants one.
And you mentioned about the vaccine and the Omicron, but we did get the direct question, what are we doing to prepare for Omicron and other variants?
The only thing we can do right now is to get smart about it. And what that means is wait for data. So far, South Africa is the place where we've noticed it the most. It is not overwhelming South Africa. The issue is that we still have so much Delta around. It's hard to tell which one's tougher. Delta or Omicron. So far, even in the US, Delta is still like 99% of our cases. So we are getting smart about it. We're educating ourselves. And so far, there doesn't appear to be anything different to do for Omicron than for the other variants so far.
We all know that COVID is inconvenient. We've got masks and everything else, all the precautions, but somebody says, how low will our numbers need to be for us to discontinue badge access to the School of Medicine and PCCLC, that's the Patient Care Learning Center buildings. So they're wanting to know when we might discontinue badge access to that building.
I would generalize rather than specialize, especially talk about badge access. It's really, when can people mix more freely is probably a more general question. And that is things like visitors, things like masking, things like room size, all that, and badges are another part of that. But we and almost every other healthcare system are using the CDC's guidance as to minimal community risk, moderate community, and high community risk. And until we get into the mild range or below, we are likely not to change our "it is okay to mix more freely" rules.
How many employees were lost due to the refusal to be vaccinated? How do we come through the vaccine mandate?
So we had 4 terminations of full-time employees due to non-compliance with the policy. We were really pleased that 99% of our staff were compliant. We had 100% compliance amongst faculty and staff with the School of Medicine. And we are continuing to mandate this with new hires and people joining our organization.
Thank you. I didn't introduce you, but Beth Alpers, our Chief Human Resources Officer. We are getting the question again, are we going to mandate booster shots for employees?
Yeah, and as Dr. Witt has said, we don't have any plans of mandating it. We are highly encouraging it. And if you get your booster outside of Staff Health, it would be very helpful if you went ahead and uploaded that through ReadySet or emailed it to Employee Health.
We know about the challenges. Shannon Pusick's hearing them on her rounding for sure, and Steve Zweig mentioned them. But we have the question, there are RNs leaving my unit daily. Is there any discussion of retention bonuses or pay increases to try to retain our staff? Please help.
Sure. So we know we're not immune to the staffing shortages that are occurring across the country and across industries. We know that compensation is not the only thing or even the primary reason why employees stay here, but we are committed to ensuring that our compensation is fair and in keeping with the market. It's much different than we would have predicted going into this year. And our compensation team is working on sustainable initiatives. We're considering a variety of recommendations, and we are determining how we're going to fund those changes that need to be made. Our preference is for market adjustments and keeping up with the market rather than short-term bonuses that get taxed all at once and don't contribute to your growing compensation over time. We will be sharing details of compensation adjustments within the next few weeks with your leaders, and then they will share them with individual employees. Meanwhile, it's really important that we focus on recruitment and other retention efforts. Our talent acquisition team has broken a record by hiring over 3,000 new employees to join our team since January 1st. And most importantly, remember, when it comes to recruitment, you are our best recruiters. Encourage people that you want to work with to come and apply to work here with you.
Great advice. Do that all the time. We have a question about the helipads. There's concerns about whether they're dangerous with the building up of the new facilities around and just the different airspace with the next gen building. Somebody has concerns that there may have been some close calls. Is there any thought to putting a helipad on the roof of one of our new buildings? Roger Higginbotham is.
Yeah. Hi, Teresa. Thanks for the question. So early in the planning for both the Next Gen Precision Health facility as well as the new children's hospital, we evaluated and we considered the current University Hospital's helipad location and that flight path along Hospital Drive. And so while we considered a rooftop helipad early in the children's hospital planning, its proximity was really too far north and too far removed from the emergency department core to really be operationally efficient at this time. What I would say to folks out there is that any time that we consider a new facility, we will always evaluate whether it makes sense or not to move our helipad to a roof location. In addition, what I would say is last week I reached out to Joan Drake, and I'll be speaking to one of our lead pilots this week to try to gain some insight from him on what he's up against with the existing flight patterns that we have. What I would also say in answer to sort of that second piece of the question, as far as there have been some close calls at ground level, you know, I think anytime you've got a helipad that's at ground level, there's some inherent dangers with vehicles and people. But I did check with our flight crew. I also checked with our system risk management, Julia Settles and regulatory affairs, and also our safety and security folks. And no one was able to substantiate that we've had any reported safety issues or close calls in the past year. Now, we do a lot of things to sort of mitigate those issues. But if you do see anything like that, if we have any close calls, they need to be reported and we'll follow up accordingly.
Roger, we wouldn't be town hall without a parking question, but this one is about people driving too fast through the parking garages, which we all would like people to slow down. But they're saying, is it possible to add a speed bump to the entrance exit of the visitor garage? Can't tell you how many people blow through that stop sign, have almost hit me and other pedestrians crossing the crosswalk.
Thanks again for the question. It is a busy area for sure. I can tell you that I have Cliff Tebby, our safety coordinator, following up on this question. I can't tell you for certain whether it'll end up being a speed bump or not. There's certainly pros and cons to adding those in certain areas. It could be a flashing pedestrian sign or so forth, but we'll look at what makes sense from a safety perspective to make it a little bit safer through there, because it is a tight space and there are a lot of people entering and exiting that garage on a daily basis. So we appreciate that question. There will be follow-up.
Okay, and I didn't mention it when we were talking about salaries, but we do see the question about EMS, paramedics and EMT, and we're sending that to HR and ED leadership to address that question as well. Before we go, we can end on a good note. So I'm going to go back to Beth Alpers and have her tell us again. Somebody says, are we getting kudos for Christmas? We announced it Friday, so maybe we got this question before we announced it to the whole organization. She says, or will it be a kudos less Christmas?
Yes, it will not be a kudos less Christmas. You will receive 750 kudos points, which translates to $75. Those points will roll out December 20th. And then, as Jonathan mentioned, you do have an opportunity to bring a +1 and see a movie with discounted concessions. At Ragtag, we will be showing the movie Jingle Jangle. And at Forum 8, we will be showing the movie Rise of the Guardian. So go to the holiday sign up and pick your movie and have some fun. And
we can't say the name of the movies and other communications because of rules, correct?
Correct. We don't want to put it in printed materials or it will cost us much more money that we want to use for compensation and other things like that. So we can share via word of mouth.
Great. Well, those are all the questions we have. Thank you very much. And on behalf of our leaders, just thank you for your attention and your hard work. And just want to say happy holidays to everybody. Hope you get a few extra minutes here at lunch to take a breath and relax. Have a great day.